Dr. Pejham, tell us, what do you think should young moms or not so young moms, anyway, moms, what are they doing or what are they not doing which contributes often to a child's problem then, whether then that child is getting major colds and flus or something else, or some asthma gets undetected or whatever it is. But what are some of the habits moms expose their children to or make sure that they don't get exposed, which can create a problem? What advice do you have there for probably especially first-time moms who haven't gone through this yet?
Right. One of the misconceptions when I see young parents with their children who frequently get colds and cough is to look at what kind of a vitamin can I give him. And a lot of what we do in our office is education, talking to the parents that yes, nutrition is obviously important, but just adding and overloading the children's body with vitamins isn't going to really change anything regarding their health. We remind them that, their daily activity, where they're at, whether in a large daycare, they're exposed to a lot of other children, and toddlers have a tendency of touching everything and not really washing their hands, and then they rub their mouth and put things in their mouth, and that is the reason why they're getting sick. So again, if they have the option of maybe picking a smaller daycare, less exposure, and teaching kids how to keep their hands clean and out of their mouth, that's what makes the biggest difference about their health and not catching these cough and colds. And they have to understand that kids need to build their immune system. So we've all been around the block, we've all been exposed to these viruses to have the immune system we have today and not be afraid of children coming down with viruses. And again, we have to educate them that they're not to rush into wanting antibiotics because their immune system really needs to learn how to fight infection without us interfering with it all the time. So we try not to overdose or overprescribe antibiotics to our patients. Instead, we take a lot of time and talking to people, and we let them know it's so much easier for us to just write a quick prescription and hand it to them rather than really sit down and educate them and let them know why overprescribing antibiotics is not a good thing.
Okay. All right. So basically, let me see if I can just a little bit summarize this. Number one, I think while people need good nutrition and vitamins and supplement, they're not the end to all. I guess you want to go to a doctor and see whether there's something else systemic which is going on and let him help you fixing it. Number two, on one hand, you need to expose the child, yes, you don't want the child to running around dirty every day and don't wash and stuff and brush teeth at night and all that stuff. But at the same time, not to be too concerned about the child having exposure to these viruses. So let me ask you, because I know a couple of people who, well, in my opinion only, they're overdoing it. In fact, I one time had in the office a person, and she wouldn't touch a telephone without first spraying it with Lysol or something like that. Now, we all here, frankly, we couldn't work with that person because the person was alienated amongst all of us. You know what I mean? But so give us a little hint there. How much sterilization a mom should do and give us some real examples. The kid is out there, plays in the dirt, and well, inevitably probably will touch things which are very dirty and even put them in the mouth. Not a real big deal as such. Well,
it just, it has to do with the amount of exposure. So both extremes aren't great. So the child that, constantly is in dirt and touching everything and not getting washed, that is a problem. And the one that you were mentioning is having our children in a little bubble, a sterile bubble. That's not good either, because the immune system has to see things and to respond to infection. And they've done some research and they found out that the children who have their parents are just constantly sterilizing everything around them, and their immune system that really doesn't see any viruses or bacteria to fight, or not enough, those kids become just overly sensitive to the environment, and there has been increased risk of asthma and allergy specifically in that population. So again, both extremes aren't good. if the kids are not getting too sick, for them to obviously go out and play with other children, to have normal amount of exposure is fine. If the kids are getting sick every single week, we need to really look at their situation, see why is it that they're being overly exposed to things, and start changing things. But again, it goes back to educating our parents. Of course, there are rare immunological disorders that, make kids not have a strong immune system. And that's something that we come in and we start doing some testing to make sure that the children don't have that. But outside of that immune deficiency problem, we try not to overprescribe antibiotics and help kids build their immune system in a healthy way.
Good. Let's talk at one point about what are some of the things a doctor or a person can do to build the immune system if possible, but not right now. We use that for a different little segment here. Thank you a lot, Dr. Pejham.
Thank you.